Hi everyone. In today's lesson, we are going to talk about cold-related conditions. All right. Yesterday we talked about heat. So we talked very briefly about this yesterday, but your body needs to stay at that 98.6. All right. It's that hypothalamus is working, and it wants to do anything and everything that it can to keep you there. Okay. We talked a little bit briefly about when our body is cold, and the first thing that we start to do is shiver. Okay. Remember that this is because we have that skeletal muscle that is going to help provide heat for us. Okay. Keep in mind that your body is going to also use the nutrition that you're putting into it to help you with this heat process. Your body likes fat and carbohydrates to help with this producing heat aspect of it. Okay, and this is important not only for what you're putting into your body, but as an athlete, making sure that you have the proper amounts of those carbs and those different nutrients in your body. So our first condition that we're going to talk about is hypothermia. We talked about hyperthermia in heat. Hypothermia is the cold-related condition where you have been exposed to cold, wind, it could be raining, and the temperatures are low, that your body temperature has started to drop as well. Okay. A big important factor to remember here is that at 95 degrees is the first time that your body starts to experience hypothermia. Okay, that's not very low considering 98.6 is where we want to be nice and normal. Okay, so 95 degrees is the first signs of hypothermia. Symptoms that you would experience: headache. Obviously, you're going to feel cold. Okay, just like with shock though, and the cold kind of acts the same way, where your body starts wanting to shut down. It wants to like hibernate. Okay, so you're breathing a lot less in that minute. You're a lot less than your 12 to 20, and your heart rate is a lot less as well. You're a lot less than that 60 to 80 beats per minute. Okay, everything's just going on a slower pace. Some signs of hypothermia: pale skin. All right, if our blood's not circulating through the body as well as it should be, we're going to have some circulation problems. Okay, you are going to shiver. But some of the more severe signs of hypothermia, there could be swelling, all right, especially in your hands and your feet. Having that change in consciousness, all right, that's definitely when it's later stages of later stages of hypothermia, all right, and having that low body temperature, right, in that 95 or hopefully not, but lower. Okay. People who are at higher risk for developing a cold-related condition would be a situation if they have a cardiovascular condition like cardiac arrest or having had a heart attack before. People who also suffer from alcoholism can have a higher chance of developing a cold-related condition. People with asthma, their lungs are not really functioning at the top capacity anyway on a normal situation. Also, big ones are going to be, have they had any issues with hypothermia before? If you've had it once, you have a better chance of getting it again, all right? And obviously your environment's going to play a big role. If you're outside and it's raining, or if it's really windy, if you are wet, all those things are going to play a different role in how your body is susceptible to heat, cold-related conditions. So treatment, what we're going to do for hypothermia, best case scenario is you get them inside, okay? You get them heat, whether that is a blanket, a heater, something. If they are wet, you do remove the wet clothing, and you are going to call 911 for this. This is a medical emergency. Our next condition is frostbite. Okay, clearly not something that we deal with a lot in Texas, but it is an important cold-related condition to discuss. Frostbite occurs from being out in that cold, usually wet environment for a very long period of time. We see this a lot in our extremities, like our hands and our toes, places that are not well covered, like our nose and our ears. Okay, and you can see on the picture that there is the red layer of skin. Then there's brown and black layers as well, okay? And all that's going to be different levels of dying tissue, okay? With frostbite, we do see that the tissue has died from being in that cold environment for too long. Now, this is not something that's going to happen in 30 minutes of walking outside, okay? It is going to be from prolonged outdoor activity. So people who are at risk of frostbite are not usually prepared clothing-wise. They're not wearing what they need to wear. If they have been consuming alcohol, all right, or if they already have a diabetes, which affects their circulation, that's going to also play a role in if they're more susceptible to having frostbite. Some signs and symptoms. Once it gets bad enough, you're not going to be able to feel it. All right, you can't feel your toes. If you put your hand on the patient's foot, they can't feel it. All right. Obviously, you can see the redness and the swelling, and that's all the fluid that's backing up in that area, and it can't. It's not circulating through the body like it should. And then the worst sign is the black part of the toes. The tissue is actually hard to touch. It is stiff, like it has died. What are we going to do to treat? All right, you're going to gradually warm the area. So when we were talking about heat stroke, it was you cool them off, best case scenario, as fast as you can, doing whatever you can. It's the opposite of that with frostbite. You want to gradually warm up the layers of tissue. All right, and you can see in the picture they've put the foot in the warm water. All right, and they're going to pat dry it off. What you're trying to do is basically you're warming up one layer of tissue at a time. Okay, but this is a medical emergency that you do need to go to the doctor for. Now, there's another condition that we see a little bit more, and it's called frost nip. Okay, and frost nip is kind of like baby frostbite. Okay, it is still a situation where there needs to be some medical attention, but most of the time the tissue can be rewarmed on your own. You do not need to call 911 kind of situation. Where frostbite, the tissue freezes. Frost nip it is getting to that point. Okay, hopefully it's caught before it gets to that point. Okay. And what we're going to do to prevent cold-related conditions, wearing light layers. All right, several layers are important. Obviously, checking your weather, know what it's like outside. All right, especially I feel like here in Texas, it's cold in the mornings right now, but then it's going to be in the 80s this afternoon. So, just kind of preparing for that. Wind and any moisture in the air are going to play a big role in your environment. So, staying dry, and if that's dry from sweating, remove your sweaty clothing and put on something that's dry. Alcohol and smoking does increase your chance of these conditions. So if you do that, if you know you're going to be outside for an extended amount of time, let's not do that, okay? And covering your head, mouth, and your extremities, okay? So you're usually the ones that are more susceptible to these cold-related conditions. All right, next time we pick up, we're going to talk about severe weather.